Thank you very much. Minister, I see you're hot for this one as well. Thank you for being here today. Okay, today I'm following up on a reply from the Minister for Health to a PQ last October, in which he said his department was considering a proposal to establish a working group to assist in the developing an updated strategy that addresses the hearing needs of the Irish population. I'm grateful for this great advocacy work of Chime Ireland, who have brought this urgent matter to my attention and who do great work in this area. I hope that you'll be able to provide us with an update on what progress has been made and when the working group will meet. I am aware, Minister, that the last time there was any strategy in hearing needs was in 2011, so a revised strategy is long overdue. Hearing loss is a common health condition, especially amongst older people. 300,000 adults in Ireland are affected, but most have had no diagnosis or intervention. At an individual level, unmanaged hearing loss can impact significantly on personal relationships and social partnerships, leading to isolation and loneliness. It can also lead to other health difficulties such as depression and cognitive decline. Based on the TILDA figures, there are 50,000 people in Ireland with depression and/or depressive symptoms due to unmanaged hearing loss, while the Lancet Commission estimated that up to 8% of dementia is preventable through early treatment for hearing loss. Hearing aids are an effective solution for most people with acquired hearing loss. More than 80% of people who get hearing aids say they improve the quality of their lives and family relationships, while fitting of hearing aids has been shown to remove the risk of cognitive decline associated with hearing loss. The health burden associated with unmanaged hearing loss is so high that in 2021, the World Health Organization concluded that for every euro invested in hearing care, governments could expect a return of almost 16 euros over the following 10 years. In the face of this evidence, it is extraordinary that Minister for Health and his department are not acting immediately to provide timely access to hearing care for whole populations. A Department of Social Protection report on the affordability of hearing aids in 2020 acknowledged that we in Ireland were prescribing hearing aids in less than half the rate per head of population compared to the UK. Cost is a major factor in low uptake of hearing aids here in Ireland. Those with a medical card who are entitled to free hearing aids from the HSE are twice as likely to have hearing aids compared to those who don't have a medical card. The hearing aid grant available to people with the required level of PRSI payments is actually less than it was 15 years ago. Meanwhile, those on a medical card can wait up to 3 years for an initial appointment due to huge HSE waiting lists. Minister, I hope that the Minister for Health's Department will have good news for me today and are establishing a working group to help develop a comprehensive and cohesive national hearing plan which will enhance public health and save the Department of Health millions of euros. Thank you.
Thank you very much, Senator Craughwell. Minister, you have 4 minutes.
Thank you, Cathaoirleach. On behalf of the Minister for Health, I would like to respond to Senator Craughwell and thank him for raising this very important matter today. At the outset, I wish to state that the Minister acknowledges that the provision of appropriate audiology services to children and adults is an important aspect of the healthcare system. The provision of such can prevent other health problems and promote greater well-being and community participation for both children and adults, as the Senator has quite rightly outlined. The Health Service Executive Community Audiology Service provides a full range of hearing assessments to children free of charge. This includes screening, assessment, diagnostic and related investigations, treatment, rehabilitation and devices, and referrals to speech and language therapy and to children's disability services if required. The HSE Community Audiology Services also offer assessment and rehabilitation for adult medical card holders. The services offered include advice on the use of assistive listening devices and the provision, fitting and repairs of appropriate hearing aids. In addition, the Treatment Benefit Scheme administered by the Department of Social Protection provides a grant towards the purchase of hearing aids for those who have the necessary PRSI contributions to qualify. A dependent spouse, civil partner or cohabitant of a qualified person may also be entitled to assistance. The National Audiology Review Group report published by the HSE in 2011 identified shortcomings in audiology services available at that time, including access issues, poor information, inadequate staffing and unacceptable waiting times, and made recommendations to address these issues. The following recommendations of the National Audiology Review Group report have been implemented: the appointment of a national and assistant national clinical lead, the rollout of National Newborn Hearing Screening Programme, which checks whether babies have permanent hearing loss in one or both ears, the rollout of the National Bone Anchored Hearing Aid Programme, which is available in 6 hospital sites nationally, the provision of a bilateral cochlear implants at the National Hearing Implant and Research Centre at Beaumont Hospital, the introduction of a domestic MSc Audiology training programme at University College Cork, the publication of an adult hearing aid best practice guidelines 2017, the rollout of the National Audiology Clinical Management System for community and acute services. The implementation of the last recommendation is facilitating accurate tracking of patients, including for the purposes of waiting list management. In addition, the HSE now employs 21 more audiologists nationwide than it did in December 2019. It is important to recognise, therefore, that the landscape of the audiology services is in a different and much better space than it was when the report was issued back in 2011. The World Health Organization's report on hearing, published in 2021, recognises that timely action is needed to prevent and address hearing loss in people across the entire course of their lives. It recommends that governments develop a comprehensive people-centred hearing care plan within their national health care plan. The Department of Health is consulting now with the Health Service Executive regarding the development of such a hearing care plan for Ireland. Thank you very much,
Minister. Before I call on Senator Craughwell, I'd just like to welcome the students from RD. I don't quite know what school you're from, but I know you're from RD, so you're very, very welcome, and I hope you have a good day here in Leinster House. Senator.
Our Cathaoirleach, our last Cathaoirleach, is very observant and he can figure out where people are from by just looking at them.
It's all subtle intelligence.
Minister, you noticed that as you're speaking I'm wearing headphones. I suffer badly from hearing loss, and I can tell you it is the most frustrating disability because in crowded spaces you find yourself not quite picking up on what people say and sometimes getting the wrong message. Indeed, my wife reminded me one time in a crowd gathering that I was answering questions I hadn't been asked, which was an interesting observation on her part. Particularly elderly people who are damned with this curse of hearing loss. There is nothing worse than it. And everything that we can do, we should do to get people, firstly, to Chimes Ireland, thank you to them for coming in here to brief us. We should get people to be more proactive about seeking help with hearing loss, and we should get this working group up and get reports out as quickly as possible, and more help for people with hearing loss. So I thank you for taking the debate on behalf of the Minister for Health, and you might bring my comments back to him. Thank you.
Thank you, Senator Craughwell, and thank you for sharing your own personal experience. It's really valuable to hear. Thank you. Thank you for sharing your own valuable experience. Sorry, Minister.
No, thank you.
That illustrates it, doesn't it?
Thank
Minister,
you,
thank you,
Cathaoirleach, and I want to acknowledge exactly as you said, Cathaoirleach, about Senator Craughwell's personal experience, and something I know from my late dad as well, who had very difficulty in hearing, and it does really almost put you on the periphery of conversations and puts you out of social discourse with people, which has huge consequences then into the future in terms of your ability to fit in and meet people, and kind of does have impacts on your well-being. So absolutely, it's very important. As I said, there is a proposal presently to establish a working group comprised of the relevant stakeholders to assist developing a national hearing plan. So I will report back to the Minister on your interest in that and potentially the possibility of you feeding into that. And under the current context, I know there are healthcare priorities which have been identified by the HSE in relation to this, and the Department will be actively working on this now over the next number of months. Thank you. I'm sure
many in here will be delighted I'm on the periphery of conversation.
Thank you very much, Minister Burke, and thank you, Senator Craughwell.